We're at the 2018 CROI. We're here with Kim Scarsi from University of Nebraska. And you just got through a press conference, and I'm going to let you set it up because a lot of important data was presented in that panel, and we wanted to speak with you about this particular panel.
Well, thank you for your interest first. I presented today on behalf of the AIDS Clinical Trials Group, study A5316. And for that study, we specifically were looking at the impact of certain antiretroviral therapies on hormones delivered via a vaginal ring. So we thought this was an important topic because we know family planning is an important aspect of comprehensive medical care for women living with HIV. We also know that there's drug interactions between some antiretrovirals and oral medications used for contraception, but there really was no data with the vaginal ring contraception. So I was fortunate to be able to present that work here today.
Because there's a lot of absorption that goes on there. That's why it's there.
Yep, exactly.
So it's profound, so it doesn't cut down anywhere. So how did that come out?
So you're absolutely right. So I think a lot of people think that the vaginal ring works somehow differently than oral medications, but it's actually just the way that it gets absorbed. And some would perceive that maybe it would miss some of that risk for interaction because you don't have the oral route of administration. But we did find very similar results. So we compared atazanavir, ritonavir-based antiretroviral therapy to a control group, as well as efavirenz-based antiretroviral therapy to the control group. Fortunately, the good news was the protease inhibitor-based regimen, although the estrogen was decreased a little bit, the progestin, which is what we think offers the effectiveness of the contraception, was actually a little bit higher than what we saw in the control group. On the other hand, our efavirenz antiretroviral therapy group had about an 80% reduction in the progestin exposure and about a 50% reduction in the estrogen exposure of those hormones released from the vaginal ring.
So you need to adjust the dose?
That would be ideal if you could increase the dose. Vaginal rings are a little tricky because you'd have to adjust how much drug is released per day. So it would require a bit of a change of the formulation.
Not going to happen.
Yeah, but I think what's important, and I think hopefully how we can learn from this information, is the new vaginal rings that are under development, specifically for HIV prevention, either alone or combined with a hormonal contraceptive, can hopefully use this information to help understand how to best use that type of vaginal ring in women who maybe aren't on antiretroviral therapy like we were using, but maybe are on other medications that behave similar.
Yeah, so you really have to look, do the pharmacogenetic or dynamics of it and so forth.
Yeah.
So it's important to have this information. So where do you go next? What's your next steps?
Yeah, so we're doing a few different things. You mentioned dose adjustment, and we are, through the AIDS Clinical Trials Group, evaluating that strategy for efavirenz plus oral forms of contraception, specifically levonorgestrel, because that's a little bit easier to adjust the dose orally, and we're evaluating whether or not that would be an effective strategy to overcome the interaction. Also working with a great group of investigators from the Infectious Diseases Institute in Kampala, Uganda, and we're evaluating dose adjustment of the implant contraceptives with efavirenz, also to try to overcome that interaction. Specific to the vaginal ring, I think that I've started to talk already with people really in the field of HIV prevention and developing these products, and they've been great as far as understanding the implications of this work, and I think they'll take that into consideration as they further develop these important methods of prevention for women.
So just to backtrack a bit, the outcomes were the same oral or vaginal ring?
So
or change a little bit?
They're a little, they're in a similar direction, I guess I would say. So slight differences. I think probably the biggest difference is we saw actually more of an effect of efavirenz on estrogen via the vaginal ring than we had orally. And that could have implications for women who use the ring also for hormone replacement therapy. Because of that difference. So we saw a bit more of an effect there. For the other drugs, the directionality of the interaction was all the same, and some slight variations here and there, but generally speaking, we saw similar results.
So what are you're going to continue on this track, or you're making some consultations with other people, as you said, pharmacodynamics.
Yeah.
What are you going to be doing in next projects? Do you have any ideas?
Yeah, so as I mentioned, that ACTG study that we're looking at the double dose, that's actually just getting under development now, and that is actually based on new guidelines, relatively new guidelines from the UK and the EU, which actually suggest doubling the dose of emergency contraception when you use it in combination with drugs like efavirenz or rifampin. And this study is going to actually systematically evaluate standard dose versus this double dose in combination with efavirenz, and also for TB infected patients, just rifampin containing TB therapy. So I'm excited about that because these are actually guidelines that are already out in the EU and the UK.
Right.
And I think the ACTG is poised to help inform whether or not that's actually going to work. And then more immediately, the implant dose adjustment study that I mentioned, we expect to have results for that, hoping sometime this summer. And I'm excited about that also because the main thing is women are using efavirenz all over the world. Hopefully that'll change as you roll out new antiretroviral therapy, but right now it's a really important antiretroviral.
It's a good drug, it just has side effects.
Yeah, I mean, we used it for so long, and you know, for women living with HIV, the challenge really is finding the right thing to use with it for contraception.
Right.
So if this implant study that we're doing in collaboration with the IDI has good results, it'll give women a real practical option for contraception until we can have different antiretroviral options throughout the world.
Well, thank you very much. I appreciate you taking the time with us.
Well, thank you for your interest.
We're always interested in the new information, yes.
All right.
Thank you.
Thank you.